You're a passionate massage therapist dedicated to perfecting your craft, and you're confident in your ability to manage pain. But there's something that can take your practice to the next level and keep your appointment book full for years to come. Many therapists believe they understand pain assessment, but there's a whole world of knowledge that you may not even know exists that could elevate your practice. For example, did you know that a rotator cuff injury isn't a thing? The rotator cuff has 4 muscle tendon units. Each is treated differently. Simply saying you have a rotator cuff injury doesn't get specific enough to fix the problem. It's like telling someone you have a shoulder pain. A resisted abduction test can reveal a supraspinatus tendon injury, which most therapists miss because they don't know how to test it or locate it. But I'll teach you how to find it and treat it. Even most doctors don't know that the only way to access it with your fingers is by putting the client's hand behind their back. This brings the tendon forward and allows the therapist to treat the injured area, which is what my targeted treatment system teaches. Did you know that most chronic injuries are in the tendons and ligaments and not in the muscles? I didn't know it. And when I learned that, it really blew my mind because I thought that the pain issues were usually in the muscles. I was so excited to learn this so I could be more effective. With my targeted treatment system, you'll learn how to treat injuries more effectively. Imagine 2 therapists. One uses the targeted treatment system and one doesn't. A client comes in with a knee pain and a bit of swelling. The one without our training massages the muscles around the knee. The client may feel some temporary relief, but pain will persist. In contrast, the second therapist trained in my system approaches it differently. After a brief history and specific assessment tests, they identify the issue as a coronary ligament injury. They know the knee has to be bent at 90 degrees to access the ligament. Then they use a single finger to work on the scar tissue for 5 or 10 minutes, provide a tailored treatment plan, and send the client home with some simple rehab exercises, delivering effective treatment. Which therapist do you think the client will return to? Traditional massage training, like Swedish or deep tissue, can bring temporary relief, but it often overlooks the root cause and doesn't provide a lasting resolution to their pain. I've been working for 60 years, but for the first 10 years or so, I wasn't all that effective. When I started out, I thought I knew a lot, but I didn't. If I saw a sprained ankle, I would work for over an hour and accidentally hit the right places, and sometimes I helped someone. But once I learned how to assess and treat injuries really precisely, I could achieve more with a single finger in just 10 minutes than I ever could in an hour. Once I learned how to truly treat people, the next 50 years have been very fulfilling. That's why I created the targeted treatment system, to pass on what I've learned the hard way, so you don't have to spend decades piecing it all together. I want to help you get right to the root of pain with confidence, bringing real, lasting relief to your clients. This isn't just another set of techniques. It's a practical approach that I'm excited to share with you, one that I know can make a real difference and bring you deep fulfillment. With these precise assessment techniques, I know exactly who I can help and who I have to refer to other professionals for the right kind of treatment. When you help someone find the right care, even if it's not you, you have referral sources for life. Most massage therapists are forced to retire after 5 to 7 years because of burnout, injury, or a struggle to fill their practice. But therapists using my techniques have been working successfully for 30 to 40 years with a full schedule because treating injuries isn't as physically demanding as massage is. Imagine not just managing pain, but eliminating it. Ultimately, for example, solving the mystery of a 15-year pain for someone and seeing them get better over the course of 3 months is incredibly satisfying. What if you could unlock the knowledge that truly transforms your practice? By joining the Anatomy in Action subscription and learning the targeted treatment system, you'll gain the skills to resolve pain at its source, empowering your career and improving your clients' lives. Invest in yourself and your business and join me on my mission to liberate people from pain and enhance their quality of life.